I think it's important that when you have an injury to certainly follow up with your primary care doctor or a sports specialist to have the injury evaluated. As our middle-aged population is getting much more active with sports such as running, I do find that they are coming in with complaints of different types of foot, ankle, as well as knee pain, and I'm seeing a lot more athletes with those types of injuries. Some things to keep in mind as you get older to prevent injuries would consist of an adequate warm-up program in addition to the fact of really going slow. I find that a lot of my older patients that are much more active tend to push a little bit too hard too early. For the younger population, I think it's also very important to continue with a good warm-up program in addition to making sure you have the adequate equipment, and that would consist of proper shoes, proper padding depending on the different type of sport. I commonly see in the office knee injuries as well as shoulder injuries depending on the sport. The knee injuries are more common amongst soccer, basketball, as well as football, and the shoulder injuries are more common amongst throwing athletes such as tennis, football, as well as baseball. The non-surgical options that I provide in the office is assistance with an athletic trainer while in the department. I also recommend physical therapy as well as different types of braces in addition to guidelines to assisting with return to play, and not to mention the basics such as anti-inflammatories as well as ice therapy. As an athlete, when you develop any sorts of aches and pains, I think it's important to follow up with a sports medicine specialist. The reason for that is because the sooner you get into the office, the sooner we have the opportunity to evaluate whether it's a significant or rather minor injury. Depending on the severity of the injury, the earlier that we intervene can certainly get you back to a return to play status in a much sooner, safer manner.